Hello, this is Mrs. Politsky, and I have your Chapter 13 short answer questions. As we go along, make sure that you fill in information uh, down below. So, question number one, what is the common element of all therapies? And this element, for the most part, is to establish a relationship that focuses on improving mental function. Number two, name 4 tasks of a therapeutic process. That is, number one, to identify the problem, two, to determine the problem's cause, three, to make a prognosis or a prediction, and finally, four, to choose and carry out a form of treatment. Question number three, explain how a clinical psychologist and a psychiatrist would likely approach the same problem differently. And this kind of goes back to what we know about the two. A clinical psychologist would more likely try to use some kind of behavior or cognitive therapy, whereas a psychiatrist, because of their profession and their training as a medical doctor, is more likely to look at the prescription of some kind of medication. Question number four, briefly explain the biomedical approach to treating mental illness and to provide 2 examples of this treatment. Okay, the biomedical approach focuses on the brain and especially with drugs. And 2 types of ways of treating this would be perhaps with psychosurgery, which would be pretty invasive as far as um, either removing or um, perhaps severing little parts of the brain, or the electroconvulsive therapy, which is probably better known as shock therapy. Question number five. The psychodynamic theory is a type of insight therapy. We'll spell that right. Because its goal is to help a patient understand the cause of his or her problem. Briefly explain how the psychoanalytic therapy help or works. The patient relaxes and the therapist passively listens while the patient says something or anything that comes to their mind. Examples of this would be the works of Sigmund Freud and many of the neo-Freudians. Number 7, briefly explain client-centered therapy. And this comes from the humanistic perspective. It was developed by Carl Rogers, emphasizing an individual's tendency for healthy psychological growth through self-actualization. Question number 8, name the qualities of therapy used by Carl Rogers that have been found to produce successful results. And some of these qualities are empathy, positive regard, genuineness, and feedback. Question number 9, which type of psychotherapist is most likely to use systematic desensitization, and how does it work? And normally it would be our behavioralists um, or therapists that are trained in this area. They create a hierarchy of fear. So whatever you fear the most is at the top with lesser items towards the bottom. And the idea is to gradually work your way up uh, to address those big fears. Question number 10. Taking a drug that a patient becomes nauseous when consuming alcohol is an example of what type of therapy, and this would be aversion therapy. This goes back to classical conditioning, and you might think about John Garcia and his work with sheep, but the idea is give an individual a certain medication. When they consume alcohol, it makes them incredibly nauseous, and at some point in time, uh, that that reinforcement, I should say, the pairing of this will make an individual nauseous every time they drink, and they will avoid alcohol. The rational emotive behavior therapy believes that the cause of psychological problems is what? And that would be irrational beliefs. And this is something that was coined by a man named Albert Ellis. Question number 12. How do antipsychotic medications work? The goal of that is to reduce the production of the neurotransmitter dopamine. Individuals who would probably be taking this kind of med would be individuals who probably have symptoms of schizophrenia. What drugs are commonly prescribed to treat bipolar disorder? lithium carbonate, uh, divalproex sodium, and things like that would be like Prozac or MOA inhibitors or Depakote. All right, final stretch. Number 14, what alternative strategy is being tested that may maximize the side effects of electroconvulsive therapy? And some of this is the transcranial magnetic stimulation. It can direct high-power magnetic stimulation to specific areas of the brain. It's less invasive, obviously, and has had some pretty decent results. Number 15, deinstitution involves removing a patient from mental hospitals whenever it is possible. I hope that you were able to get everything written down, and if you need to go back, obviously you have that opportunity to do so. Thank you.